Today against the Denver Broncos, we saw Lamar Jackson of the Baltimore Ravens go down with a bad-looking left knee injury, and anytime there is any type of a knee injury like this, especially to a high-profile player like Jackson, there's immediate speculation on the severity of it. Fortunately, it seems as of right now, sources are classifying this as a knee sprain, and John Harbaugh actually elaborated a little bit more on this after the game, saying that he expects Jackson to miss anywhere between days to weeks, and that this is not going to be a season-ending injury for him. As of right now, they are not saying what specific structure they believe to be injured in Jackson's knee, so I'm going to go ahead and take a look at the injury video and see if we can determine that. Also, since there is a grading system for sprains of the knee and people may not be too familiar with that, I'm going to go ahead and also focus on that with this video. Welcome back, everybody. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I try to explain them so that they are a little bit easier to understand. I also talk about how that person would present to physical therapy and what we would do to treat them to get them back to the field. If you like today's video and you find it informative, go ahead and please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now here we can see on the injury video that as Jackson is being brought down to the ground, the front of his left knee is going to make direct impact with the ground. Now here I have a model of the knee joint, and so right here we have the thigh bone, which is known as the femur, which is going to come down and make up the top portion of the knee. And then at the bottom here, this is where we have two other long bones, one being the tibia, or the bone we often refer to as being the shin, that's going to come up. And also here on the side is the fibula bone. Now there are some very important structures in the knee, 4 of them being ligaments that contribute to overall knee stability. The first one being that anterior cruciate ligament, or the ACL for short, and that's located right in through here. As we go to the medial or the inside portion of the knee, here we have the medial collateral ligament, or the MCL for short. As we go to the side or the lateral portion, this is the lateral collateral ligament, or the LCL for short. And finally, as we go to the back of the knee, here is our posterior cruciate ligament, or the PCL for short. We also have 2 other really important structures. They are the medial and the lateral meniscus. You can think of these as shock absorbers between the femur and the tibia. Without that, there would be bone on bone and it would be very uncomfortable. Now, as we take another look at the injury video here, once again, as he's being brought to the ground, the front of that knee is going to take the impact, and that force is going anterior to posterior. And as I do that on this model, you can kind of see what happens here. The bottom portion, being the tibia, is going to get driven backwards. Now, as I do this, this is going to stress several structures within the knee, but the one ligament that actually prevents this posterior translation like that is the PCL. So as I put a posterior force, you can see that that is going to make that PCL very taut, and this puts it in a position to be injured. Another instance that I see oftentimes in the clinical setting is somebody, whether they're driving in the front seat or they're a passenger, if there's any type of car wreck where there's a jarring force where the car has to stop and the front of the knee actually hits the dashboard or any portion of the car like that, that also creates that posterior translation and can also injure the PCL. So this is a very common mechanism of injury for that PCL because that's the type of motion that it is designed to prevent. It is very possible that some other structures in the knee are implicated as well. The patella, which I actually removed from here, that could have any type of a contusion on it because that made direct impact with the turf as well. Any other ligament could be stressed kind of in that position depending on the force. But most commonly as of right now, based on the video, it looks like that PCL is involved. Now there is actually an on-field test that we can do to determine whether or not the PCL has been implicated, and that's something known as a posterior drawer test. So essentially what you do is you have the patient lie there and you have their knee in a bent position like this, and you are going to put that posterior force, and if you feel any laxity compared to the other leg, or if the person reports pain, then this is going to make you believe that the PCL has been implicated. But of course, the gold standard for this is the MRI, and that it sounds like he's going to be having tomorrow. Now there is a grading system for sprains of the knee, and they are grades 1, 2, and 3. In a grade 1 sprain, this is when you're going to get some stretching of that affected ligament, but there's no tearing at all. In a grade 2, this is when you're getting some stretching and some partial tearing. And finally, in a grade 3, this is when you're going to be getting a full rupture. Now, obviously the full rupture is the worst case scenario, and this is usually something that is going to end a person's season. So it seems as of right now, since John Harbaugh is already predicting days to weeks, that is not going to be the case. In a grade 1 situation, this is when a person is going to miss anywhere between 2 to 10 days. And in a grade 2, this is where they're going to miss anywhere between 4 to 6 weeks. If I had to put a guess on it as of right now, it seems like Jackson is dealing with more of a grade 1, but he's due to have an MRI tomorrow, so we'll know the severity of it, and we'll also know if any other structures are implicated. So that can definitely give us a much better accurate time frame. Now, when we see somebody that has had an acute PCL injury, essentially in the beginning, we want to make sure that we control the swelling and inflammation, and we also help with pain control. So we're going to do that with that acronym RICE, where R stands for rest, I stands for ice, C stands for compression, E stands for elevation, because we want to essentially make that person as comfortable as possible while getting all of that swelling and inflammation out of there. Then when a person is appropriate, if the person does not have any instability at the knee, then we can get pretty aggressive with that, and we can start working on range of motion, strengthening, weight bearing, all those types of things. And then finally, when they've cleared their doctor's visits, then we can add in sport-specific movements and finally return them to the field. Now, if anybody has any sort of instability at the knee, obviously this is more of a severe PCL injury, more on that grade 2 side. So with this, we have to be a little bit more careful, and that can prolong the recovery time. So we're going to need a little bit more information regarding the severity of his knee injury, which we should have by tomorrow. Once I hear that, I'll be sure to update everybody in the comment section. And if you happen to hear anything, please feel free to update everybody as well. And that's it as of right now regarding Lamar Jackson's most recent knee sprain. It does look like he's dealing with a PCL injury, but it seems to be a low grade 1. Hopefully for him, that is the case. And once again, I'll keep everybody in the loop. Once again, thank you very much for watching today's video. I really appreciate it. If you like this type of content, please subscribe to the channel because it helps me a lot. Thanks for tuning in, and I'll see you next time.